You are looking at a developing human being deep inside its mother's womb. Under normal conditions, its mother will supply everything this unborn child requires for full and complete development during its 9-month journey. Life in the womb may be the safest place this child will ever know. But in more and more cases, it's becoming increasingly clear that life in the womb is anything but safe.
I had a button that I had for a couple of years that said that the most dangerous place in America is in the womb. It disturbed me no end when I saw that button, because something in me thought that might be true. That a fetus this size could actually be our most endangered citizen.
Very simply, whatever you put into your body, you're giving to your baby.
You are looking at a child who displays the classic effects known as fetal alcohol syndrome, or FAS. The mother who bore this child drank regularly, and probably a lot. Sometimes known as a $1 million baby, he was born an alcoholic. He has endured countless seizures as his body slowly rids itself from the effects of his toxic addiction. But it's what you don't see that has damaged this and tens of thousands of other children for a lifetime. All are mentally impaired, and most of them will require hundreds of thousands of dollars of additional expenses for full or part-time medical, physical, psychological, emotional, and educational care. This is because alcohol is a teratogen, a drug highly capable of causing damage to the human body, particularly to the human brain.
Blood levels of substances that women take typically are higher in their fetus than in their own blood circulation, simply because as an adult she has all kinds of enzyme systems to decontaminate her from that substance, and the fetus, depending on his gestational age, may have none of that or a small amount of that. So in essence, that means that a small hit for mom is a real buzz for the baby.
Sometimes the unborn child is literally swimming in an alcoholic environment. There are cases when the delivery room filled with the stench of alcohol as the child was being born. That child's brain didn't stand a chance for normal development.
A baby in utero, his brain at 7 months is perfectly smooth. It's like a little tennis ball. It's a little gray, smooth surface in there. And that baby in the last trimester of pregnancy is growing 150 million brain cells a day. That's a lot of brain cells.
From 30 years of research in countless animal models, it's clear that alcohol can do pretty much anything to the human brain to cause problems.
And he's trying to grow his 150 million brain cells. You have him in a toxic environment to begin with, but then you're also cutting off his oxygen supply. Those are the kids that, when they're born, then have some significant little, like spiderweb scarring all through their brain that keeps it from functioning as smooth as it can be. Now, by the time a typical baby is born, that brain growth has dropped down to around 10 million cells a day. By the time you're 6 months old or so, that's it. You never, ever get another brain cell.
And there's no evidence that once the brain is damaged, it can recover. Much to my sadness, there's just no evidence of that.
Unlike other body cells, damaged brain cells do not regenerate. Missing cells will not be replaced. Simply stated, the unborn child had a once-in-a-lifetime opportunity for complete brain growth.
Drinking alcohol during pregnancy increases the risk of miscarriages, of stillborn babies, of babies that are not viable during the first year of life.
Another form of birth defect caused by the use of alcohol is fetal alcohol effects, or FAE. Though the child is spared the physical deformities associated with FAS, fetal alcohol-affected children nevertheless are brain damaged.
The majority of children are on the more subtle end. They have normal-sized brains, They have normal neurologic exams, but their brains don't work quite right.
These milder forms of FAE often remain undetected for years, and it's very difficult for the parents of that child.
They often need to be told things many times, many different ways, in many different tones.
He doesn't make friends well. He doesn't communicate effectively. He isn't organized. He doesn't make good choices. Every child's pattern is slightly different, but this commonality is they just don't make their way in the world.
In a recent study for secondary disabilities in alcohol-affected persons, 90% had appreciable mental health problems, 60% had been in trouble with the law, and 60% had major disruptions in their education. They were either expelled, suspended, or dropped out of school. Nestled in a scenic rural area in Oregon is a haven where children with mental disabilities can go for help. This is Scar Jasper Mountain. It's a 24-hour residential facility specifically designed for children with advanced cases of mental, emotional, and psychological problems. Like other similar facilities, it sees an increasing number of children who have come from a chaotic family environment and whose parents abused the use of alcohol, especially with the child inside the mother's womb.
I firmly believe that the environment in the womb, the child is totally aware at that level of whether it's a chaotic environment or not. And I think they are aware at a subconscious level whether it's a safe, nurturing environment or if it's a chaotic, abusive one. Environmentally, when the child's brought into the world, and let's say an extreme level that the parent is abusing alcohol and drugs, that's going to have effect on their ability to care for the child. This particular kid I was talking about remembers that mom went to the bar all the time. He would talk about being drunk in his mom's stomach. I swam around with a whole bunch of beer and I was drunk all the time.
An extreme case? Perhaps. Yet combinations of mental, emotional, behavioral, and psychological problems are quite common. And children displaying some or all of these dysfunctions are especially difficult to diagnose, treat, and improve. As for the cure, there simply isn't one.
Hey, Mom. What are you doing? I'm just
Chris is a normal-looking and enchanting young man. He also has a lifetime full of problems. His mother, Dawn Jones, made a choice she now admits was very wrong. She was using during her pregnancy with Chris. For Dawn, it was a mixed bag of substances with alcohol as the common factor. She was unprepared for a future that today is her reality.
I was addicted to drugs and alcohol from the time he was born until he was about 3.5, and he went to foster care and I got clean and sober. Alcohol was not something that I consumed large quantities of, but at the same time, I probably drank alcohol 3, 4, 5 times a week in the amount of at least 1 or 2 beers. It's hard to say which one affected what, but I'm sure that some of his problems have been created by the use of drugs and alcohol.
It's not uncommon for a mother to use a combination of toxic substances during the course of her pregnancy. Nonetheless, many of Chris's mental, emotional, and psychological difficulties are the same as those found in fetal alcohol-exposed children. And of all the teratogens, it is a proven fact that alcohol does the greatest amount of damage.
Okay, I am not taking you to Target.
I want my money.
I am not taking you to Target.
I didn't get it. I want my money.
What were you told?
When we go to buy something?
When we go where?
To Target.
And are we going to Target yet?
Yes.
Not yet.
Yeah!
Chris, like so many other substance-affected children, is learning how to deal with life outside the confines of special learning facilities. It will be a tough battle, and one he may never be able to win.
So right now, I can't raise my son alone. I raised him till he was 11 by myself. And it just got too hard.
Sadly, all forms of birth defects attributed to alcohol have always been 100% preventable.
I watch women go through the same types of things that I went through. Finding it so difficult to stop. It's a lifetime of suffering for the kids. A lifetime. You know, they don't choose to be born this way.
For a woman who's planning to have children in the near future, how much alcohol is safe? For a mother who is pregnant, should she consume any alcohol at all? And for a mother who has just delivered, when should she drink again? The answers may be surprising, but they're also predictable.
Not every single child who's exposed to alcohol ends up with a damaged brain. So it's like it increases the risk of this happening.
In the end, it kind of comes down to the same situation we actually have with drunk driving. If you get really, really drunk at a restaurant and then drive home, will you have an accident? Not necessarily. You might get home okay. Are you at high risk to have an accident? Yes, very high risk. But that doesn't mean you'll have an accident every time.
And it's essential that mothers do not drink even after the child has been born. Alcohol that's present in the mother will be transmitted to the newborn via breast milk. And since the child's brain is still in a state of rapid development, the chances for brain damage remains high. So the answer as to how much alcohol can be safely consumed without any risk throughout pregnancy is best described as this. No alcohol means no risk. One drink at any time during the term of pregnancy places the unborn child at risk. As the mother introduces more alcohol into her system, the risk of damage to the unborn child dramatically increases.
No one can guarantee you can have a healthy baby, but you could guarantee to your baby that it would not be born with alcohol-related birth defects.
So the question remains, why would a mother drink at any time during her pregnancy? What factors may be causing her to continue? Perhaps it's because we, as a society, are sending mixed messages about the use of alcohol.
To me, that the political climate needs to be supportive of the clean and sober lifestyle that we expect of our pregnant women. Why should we expect it just of pregnant women? Does it not damage men? Does it not damage fathers? Does it not damage our political structure? It damages everything.
Perhaps alcohol is used as a means for self-medication. For instance, as a way to relax from anxiety or stress.
One beer is toxic. Yeah, maybe you're not an addict, maybe you're not an alcoholic. It's still a mind-altering substance that you take into your body that alters how you think and feel. Why are you doing that? You know, to relax? That tells me you need some relaxation tools.
Or could it be that there's a problem with the continued use of alcohol?
I believe that there is a safe and a dangerous way to use alcohol. But women have a problem, which is that the highest time of risk is early in pregnancy when they don't know they're pregnant. And therefore, if they're thinking about the possibility that they could be pregnant, that's when they need to restrict their alcohol use to essentially zero. If that's a problem for them, then they have a problem with alcohol, don't they?
I believe that addiction is the only disease that says that it's not a disease to the person and to the doctor. Meaning on interview, if you were to ask me, do I have shortness of breath? Do I have palpitations? Do I think that I might be having a heart attack at times because of the nature of my chest pain? I would probably say, yes, help me. But if you asked me, are you using? How much do you use? Are you using an illegal substance? Are your senses affected by the drug you're using? I would deny them all if I were in my disease of addiction.
You don't want to alienate her. You want to help her, bring her into the medical community, make her feel comfortable, because this is where she's going to have to be with this affected baby if she's going to take care of him.
In the heart of every woman who is pregnant is an enormous amount of fear and guilt that anything she's doing, an aspirin, a Tylenol, a bad dream that perhaps has affected and caused a problem in her baby, is creating great pain in her that can always be approached with love and understanding.
And that love and understanding begins in the environment where she lives. The very people she associates with, her friends, her family, even her co-workers, all can offer effective support as they help to guide her to zero alcohol usage before, during, and after pregnancy. But no single person has a greater influence on her decision to stop drinking than the man that's in her life. It is the couple's decision that could place their child in jeopardy.
Women drink with men. Women drink because of men. And it is their baby too.
It's rare to find a woman who has an isolated drug problem separate from her husband.
And the father of that child should be the absolute most important person in that woman's life to help her get clean and sober, and that may mean he has to stop drinking too. Men have to be involved with this with their heads and their hearts, their minds, with their souls. That's how we have to capture them.
Regrettably, there are times when the man or the environment is not a stable platform for the kind of support a woman needs during this critical period. She has some tough decisions to make.
Many people that are addicted need to get away from their drinking, drug abusing environments in order to break the habit. And they need to be with other people that are recovering together.
Oftentimes I think we need to address the fact that this is a family problem. This is a problem in that relationship. And then sometimes I think the mom needs to make a very difficult decision that if she's going to maintain her sobriety and he isn't, she may have to choose between her life, her safety, the safety of her child, her sobriety, or the man.
And those withdrawal periods can go anywhere from weeks to many, many months. And with the real feeling, then comes the real memory of abuse, of sorrow, of grief unresolved. And that is a time of enormous emotion and relief of that emotion, crying, sharing. That's a period of time when a great deal needs to be provided for the family.
Our society has been using alcohol for thousands of years, and we've probably been damaging our children just as long. The effects of alcohol abuse range from slight to severe. It's a complex disease with a variety of physical, mental, emotional, and psychological impairments. It's a disease that can have a lifetime of physical, mental, emotional, and psychological effects. It affects your co-workers, your friends, your family, yourself, and your children.
A young woman with fetal alcohol syndrome was here being examined, doing brain behavior studies for our research. And I asked her if she'd like to be interviewed by these television people from London, and she said sure. And so her mother and I and a couple of our researchers, we sat around the table and listened while they interviewed her, and she was really straight on. She was maybe 20 years old. She's handicapped enough that she'll need assistance all her life. And she had remarkable insight. And then he said, if you could talk to other girls about drinking during pregnancy, what would you say? And she looked totally startled. And she said, well, I'd tell them, don't drink during pregnancy. You wouldn't want to have a girl like me for your child. And we were weeping. We were sitting around. I've never seen the tape, but it was such an amazing experience to have her say that. So it was just straight out of her heart. And it's honestly the reaction of many, many of our children. They're too handicapped to do what they dream of doing in life, but they're not handicapped enough to think that they're happy not doing those things. So they live in a world of unfulfilled dreams. They can dream wonderful dreams, but they can't carry them out.
As another human prepares for life outside the womb, its mother controls its destiny. With the support from its mother, her family, and her friends, it stands a fighting chance for a complete and normal life. No one can absolutely guarantee that a mother will deliver a healthy, happy baby, free from the effects of disease and discomfort. But a mother can absolutely guarantee that she will deliver a baby free from the effects of a disease known as fetal alcohol syndrome. For fetal alcohol syndrome is a disease born by choice. It is, and always has been, a disease that is 100% preventable. Make your decision the right choice. The life of a child may be in your hands.